being in a marriage. How many people are functioning in a marriage? Before you actually enter into this relationship, you have to think about dating outside your culture. Welcome to the Dr. Tunishai Ford Show. I am so excited about today's show. We're going to examine autism and how to deal and understand these very special needs children. And today, I have two very special guests, but I'm going to interview first of all the Vice President of the Autism Society of Wayne County, and her name is Miss Michelle Lloyd. Welcome. Thank you so much for being with us on our show today.
Thank you for having me.
I'd like to ask a question. The first question I want to ask you is, what is autism? Explain that.
Autism is a neurological, chemical, genetic disorder, and we can't really say anyone knows what causes autism. It's social, and it's also it's a social and it's a speech development delay process in children. Children, you can see 20 children playing, and a child with autism will be off to itself, playing by itself in most cases.
Okay, now have they discovered what causes it, and what are the characteristics of autism? What are some of the characteristics of autism?
Some of the characteristics of autism are children who flap their hands, they're fixated maybe on one particular toy, or drawing pictures all the time. Another characteristic of autism is a child likes to be by itself. Work is play, and play is work to them.
Okay, now who is more likely to develop autism?
Boys are.
Okay, so it's more prevalent in boys.
Yes.
Okay, what about the girls? I mean, what's the ratio?
I think it's maybe 1 girl to every 10 boys.
Okay, are there different degrees of autism?
Yes, the autism spectrum is a very wide spectrum. You have the ones that are very low functioning, and they may have to always have someone do something for them all the time. They can't do anything. They have meltdowns. They can't deal with certain sounds, and their balances are off. They may never learn anything, where there's other children in autism who go to college. You have professors. Dr. Temple Grandin, for example, is an autistic person who has autism, but she's able to totally do everything for herself.
That is really amazing. You said there are autistic people who can actually go to college?
Yes, we have some right here at Michigan State, at Wayne County Community, but a majority of them do have a one-on-one with them to help them get around, because as you know, autistic people are used to doing things the same way all the time.
Okay, now, I've heard of situations where a child is born normal. They come into the world, they're normal, 1 or 2 years old, 3 years old, and then maybe a medical condition, maybe some medication they may have taken, and then all of a sudden they develop autism. Is that something that you've heard of? Is that something possible? Is that possible?
I've heard of that, but I believe that children who are born, if they have autism at the age of 4, they were born with the autism. It was said that there were certain shots with mercury in it. Once the mercury got into the child, my grandson is 10 years old. Wade, at the age of 3, he counted, he talked, he played, he interacted with us. He received his MIR shot, and then that had mercury in it. And what happened is, all of a sudden, there was a glare over his eyes. He started looking off to the side. He always had to have an instrument like this in front of his eyes. He stopped communicating with us. He stopped playing with us. Then I knew he had autism.
Okay, guys, autism in your family, I mean, is he the first child that was diagnosed with autism in your family?
I have a niece and a nephew on my husband's side that has autism. We didn't know it at the time, but we know now that they do have some autism, a characteristic of autism in it.
And when was she diagnosed?
They were really never diagnosed with it at youth. I think David might have been about 24 years old when they noticed that he had autism / cognitive impairments.
Okay, what is the percentage of autism in America right now? What is the percentage?
In the year 2005, it was a ratio of 1 to 250. In the year of 2009, it was a ratio of 1 to 150. Now it's a ratio in 2010 of 1 to 110.
So it's really very, very prevalent right now.
Yes, it is.
And what can we do as a community to kind of offset this? Is there something we can do about that, or?
One of the things I think a community can do, we start in the schools. My principal, Mr. George, is a special ed. He has a master's in special ed and also autistic nephew. He's very well versed with autism, and I think one of the things that need to happen in the school base, the principals need to be educated on autism. Then the regular ed teachers, we need to introduce the autistic children to the regular ed students so they'll know that autism is not a disease. It's nothing they should be afraid of. In the neighborhoods, I believe that the police stations should know autistic kids and children, because some of them have a sleep syndrome where they walk, they stay up all night and they'll leave the home and won't know where they are. The neighbors should know about the autism, and we should educate people. A lot of people look at autistic children as being bad, spoiled, or even I've heard people say they have demons. But it's something that if they could get rid of, I'm sure they would. But loving them and treating them just like regular, normal, everyday children is the best thing in the world you can do. But most important of it, be educated on autism.
Because I have heard of examples where the child acts out, they have some very serious behavioral problems. I remember there were times when I used to teach, and I think we had an autistic child, and it was very, very difficult to control that person. So that might be one of the issues that they have. You know, they don't know how to deal with it, because the child will act out, because like you said, they don't know how to really socialize.
Right, and they can't relate. So one of the things we've learned with the secretin is something that's developed in our stomachs. Autistic children, when some children receive the right amount of secretin, it helped their behaviors, they change. But that was something that never brought a child out of autism. Also, they may be in pain and can't tell you. What we do know is behaviors or communication.
Okay.
And that child is trying to tell you, just like when a baby cries, what does it want? To be held, fed, or changed. This is the same with autism. If an autistic child is having a meltdown, fluorescent lights, they can hear them, we can't.
Right.
I had a kid that used to try to throw water up in the fluorescent lights to put the lights out so it wouldn't hurt his ears. Another thing, a lot of autistic children do have ear and throat problems.
Okay.
And so they will have the tendency to put their hands on their ears and make loud noises themselves, because they're trying to drown out all the noises that are around them because it's painful to them. And they can't tell us, that hurts. Okay. You're talking too loud. Okay. With autistic children, we should look them directly in the face. Take our time and talk to them. They can't consume what we're saying if we talk too fast.
Right. I can understand
and
that.
They also don't like you in their space, a lot of them. Okay. So we need to learn about their world. Yes. Just like we want them to adjust to ours, we need to learn about their world and give them the respect that we want in ours.
Okay, now there's help for them, and there's something called the MCPNs. Could you explain that?
Yeah, Managed Care Networks, that's a mental health development place that was ran by David Packetine. And what happens is they will help parents. They will help parents get assistance in their home with people who will come in and help to train their autistic child how to use the pot, get them out of diapers. They will babysit so parents can have some relief to go to the stores. They have respite situations for younger children. They even have caretakers who come in and teach the autistic child how to walk around and get familiar with their neighborhood. They will also bring in psychologists and behavior specialists that will help you to do a behavioral plan to help redirect your child, so some of the meltdowns and the unsociable things they're doing, they will do them sociably and correctly.
Okay, now your society, the Autism Society of Wayne County, what do you all do?
What we do is we get information from parents. We're a nonprofit organization. We do different fundraisers. We bring we bring in special people and speech therapists, OT, social workers, people from Social Security to teach the parents how to get their benefits. We try to gather all the information that we possibly can to help parents with children with autism on how to raise their autistic child properly.
Okay, and are they able to function in society when they become adults?
Some of the autistic children are. The Managed Care Networks do have facilities for children who are adults with autism, and they may always need 24-hour care. Just like I said, Temple Grandin is an exception, and there are some autistic people who I've met that are married and have children who don't have autism.
So what would you tell the families to do? There are people who have family members And oftentimes it's always just like one person to be the caretaker, of anybody who may have a deformity or illness. What kind of advice would you give to families who have an autistic child in the family?
I would say in Michigan alone, there are, in all our counties, Wayne, Oakland, Kalamazoo, Downriver, there are all types of autism centers where parents can go to. There's websites that are national. I would say to the family members, please go to a class.
Okay.
Please go and learn and hear. Listen to what other parents and other mothers, other educational people have to say, social workers, about autism, so they will learn that this child is just not a headache or a child who's acting out just to act out.
Okay.
Go and actually hear and see what it's like. That way, you'll be more helpful in understanding with autism.
All right, well, thank you so very much. We're going to take a break right now, and we'll be back in just a moment to get a testimony from a young lady who has a powerful testimony about raising her child for 35 years and how she got through this ordeal with her child. Thank you. We'll be right back.